This segment of DelmarvaLife is sponsored by TidalHealth.
It's a relatively common condition, but can make everyday tasks seem much more difficult. For those living with peripheral artery disease, moving around during the day can be harder than expected.
Yeah, the health of your circulatory system might be one that you take for granted, but for people facing a PAD diagnosis, rehabilitation is possible through some of the latest medical advancements. And we are happy to be here this afternoon with Dr. Wilhite, Chief of Vascular Surgery with TidalHealth. Doctor, welcome to DelmarvaLife.
Thank you.
So for those who may not be familiar, what is peripheral artery disease, or PAD?
Yeah, I mean, just as at its simplest, it's narrowing or blockage of the arteries that supply blood flow to the periphery, the arms and the legs. The majority of patients, it affects the legs, and so we think of it as just reduced blood flow in the legs.
So what are some of the warning signs? And I would assume early detection is important, right?
The earlier you're aware of it, the better off you are. You can begin to manage it earlier in life and prevent other problems. The challenge with PAD is that the majority of patients have no symptoms whatsoever. At its mildest, when there are symptoms, patients develop what we call claudication, which is a Latin word to limp, because patients they develop pain in the leg when they walk a distance, muscle runs out of blood flow, develops lactic acid and burns. And so a patient will tell you, hey, you know, I can walk a block and then my calf cramps up and I got to stop and wait a minute. They're waiting for that blood flow to catch back up. Leg feels fine. They can walk again another block.
Beyond them telling you the symptoms, how do you diagnose it?
There's actually a quick, simple test that a doc can do in the office called an ankle brachial index. Very simply, take a blood pressure cuff, measure the arm pressure, put it on the ankle, measure the ankle pressure, and compare the two. If they're not the same, that's PAD.
Wow.
So what advancements have been made with vascular health these days?
Oh gosh, it's it's endless. You know, I came to practice here 21 years ago, and how I treat patients now, from diagnosis, therapy to surgery, is completely different within 20 years. You know, we used to treat patients really primarily with open surgery. If blockages were bad enough, I would have to open a leg up and sew new arteries in.
Wow.
These days, it's completely different. 90% of the patients I take care of are done through a catheterization procedure. We use balloons and stents, kind of the same way you hear about cardiologists treating the heart arteries. We use those same tools, a little larger, the arteries are bigger, obviously, but we do those same things actually right in the office as an outpatient setting. So
Wow.
It's incredible.
That is incredible.
Yeah, diagnosis is all with ultrasound testing, non-invasive. So, you know, kind of one of the scariest things for a patient is a doc says, hey, you know, look, I got to put you through some tests and find out what's going on. When it's PAD that we're looking at, it's all non-invasive, easy stuff. An ultrasound, same way that we look at, you know, for a baby, rub it on the legs, look at the arteries, measure flow, and you can tell exactly what's going on with that.
And then what does a role of rehabilitation play in recovery?
It's huge. You know, before we jump into doing surgery or a procedure for a patient with peripheral vascular disease, the first step is to just get them walking again. The majority of patients who are able to engage in a routine exercise program will have, you know, their walking distance, how far they can go before that leg cramps up, will double in just 6 weeks of walking. One of the things that we offer at TidalHealth through the outpatient cardiac rehab program is actually a supervised walking program for patients with PAD. So if you have a diagnosis of PAD, if your primary care doctor feels that you may have this, you can be referred to that program. It's 12 weeks of supervised walking. You get to come to rehab. They do some education with you, put you on a treadmill, help you learn your limits and how to extend them over time. Those patients have a great response to that program and helps them avoid needing surgery in the future.
So if someone watching thinks maybe they have PAD, what's the next step? What can they do?
Just talk to the doctor, you know, just say, hey, you know, look, I might be at risk of this disease. If you're having pain walking around, kind of remind the doc that this might be PAD. People who should be thinking about this, you know, this becomes more prevalent as we grow up. Once you're into your 60s, 1 in 5 of us have some form of PAD. So 20% of us will have it. A simple ABI can be done to check it, that ankle brachial index that we talked about. If you ever smoked cigarettes, if you have diabetes, high blood pressure, high cholesterol, those are some of the triggers that put you at a greater risk of having PAD, and really should be talking to your doctor about checking for it.
Because early intervention is best. Dr. Wilhite, thank you so much for coming in and talking
thank you
this
very
afternoon.
much.